Hey everyone, welcome back, or if you're just joining us, welcome to KSSP Podcast. I'm Spencer.
And I'm Katie. Today we are going to be talking about different types of overdoses and how to manage each one of them. So we're going to start off with opioid overdoses, which I think are the most common. Don't quote me on that, but I'm pretty sure they are. First, let's go over what is naloxone. Well, naloxone, also called Narcan, is a medicine made to quickly reverse opioid overdoses. It is an opioid antagonist. This means that it attaches to the opioid receptors and reverses and blocks the effects of other opioids. But if there are no opioids in your system, it will probably have a couple of side effects, but ultimately have really no effect on you. So there are a couple different kinds of naloxone. There's injectable. The proper dose is drawn up from a vial. Usually it is injected with a needle into the muscle, although it might also be injected into a vein or under the skin. Nasal spray. This kind of naloxone requires no assembly and is sprayed into one nostril as the person overdosing lays on their back. So studies show that injectable Narcan is more effective than nasal spray, although any Narcan is better than none at all for an overdose. The half-life of naloxone is roughly 30 to 90 minutes. This is less than typical opiates, so there may be some overdose effects after the naloxone wears off. This is why getting help from medical professionals for overdoses is essential. People who are given naloxone should be observed constantly until emergency care arrives. After the last dose of naloxone is given, they should be monitored for 2 hours. Make sure breathing does not slow or stop. So, here's a question that a lot of people don't know the answer to, or at least the correct answer. Can fentanyl be absorbed through the skin? This is a common misconception that fentanyl can be absorbed through the skin, but it is not true for casual exposure. You can't overdose on fentanyl by touching an object with powder fentanyl on it. The one case in which fentanyl can be absorbed through the skin is with a fentanyl skin patch, typically prescribed by a doctor, and it takes 2 hours of exposure for those patches to dissolve into the skin. This is important to keep in mind as opioid overdoses are a serious situation in which we need to be aware of their root causes. So we're going to go over this article. It's from SAMHSA. What do we need to know about opioid overdoses? So let's see. So an opioid overdose can occur for a variety of reasons, including when a person overdoses on an illicit opioid drug such as heroin or morphine, when a person overdoses on a medication used in medication-assisted treatment, many of which are controlled substances that have the potential for misuse. This can occur when someone accidentally takes an extra dose, deliberately misuses a prescription opioid, or mixes opioids with other medications, alcohol, or over-the-counter medications. An overdose can be fatal when mixing an opioid and anxiety treatment medications, including derivatives of benzodiazepine such as Xanax and Valium. When a person misuses an opioid-based pain medication, using not as prescribed by their physician or one prescribed for someone else. Children are particularly vulnerable to accidental overdoses if they take medication not intended for them. So an opioid overdose can occur even with prescription opioid pain relievers and medications used in MAT, which is medication-assisted treatment, such as methadone and buprenorphine. In addition, individuals using naltrexone for MAT have a reduced tolerance to opioids, and therefore using the same or even lower doses of opioids used in the past can cause life-threatening consequences. Also follow the instructions you receive with your medication. Ask your practitioner or pharmacist if you have questions or are unsure of how to take your medication. So here's how you can help avoid opioid overdose. Take medicine as prescribed by your practitioner. Do not take more medication or take it more often than instructed. Never mix pain medicines with alcohol, sleeping pills, or illicit substances. Never take anyone else's medication. Prevent children and pets from accidental ingestion by storing your medication out of reach. and dispose of unused medications safely. Talk to your MAT practitioner for guidance or for more information on the safe disposal of unused medication. You can visit this FDA site or the DEA's webpage. All right, so now we're going to talk about recognizing opioid overdoses. Call 911 immediately if a person exhibits any of the following symptoms. Their face is extremely pale and or feels clammy to the touch. Their body goes limp. Fingernails or lips have a purple or blue color. They start vomiting or making gurgling noises. They cannot be awakened or are unable to speak. Their breathing or heartbeat slows or stops. So treating an opioid overdose. If the person has stopped, so first you got to call 911. Even if you're planning to leave the scene, you should still call 911. Like, you don't have to be there when they show up. You can do it even as you're walking away. You can still call 911, although you really should stay there and make sure the person doesn't die. But, if you're that worried about the police, at least call 911 before you leave the person so that somebody can come help them. If the person has stopped breathing or if breathing is very weak, begin CPR, best performed by someone who has training. And although if you don't have I guess I don't know about if you don't have training. If available, treat the person with naloxone or Narcan to reverse opioid overdose.
So, next we're gonna move on to alcohol poisoning. So, according to Mayo Clinic, symptoms of alcohol poisoning include seizures, slow breathing, less than 8 breaths a minute, irregular breathing, a gap of more than 10 seconds between breaths, confusion, vomiting, low body temperature, passing out, unconsciousness, and unable to be awakened, and or blue tinged skin or pale skin. And what should we do if we notice someone experiencing alcohol poisoning? Well, generally, as always, we should call 911 and be ready to provide info to operators and emergency staff. Don't leave the person alone and keep them on their side. Do not let them lay on their back, as this could cause them to choke on their vomit.
All right. And then next, we're going to talk about overramping, aka stimulant overdose. And this is according to harmreduction.com. So physical symptoms include nausea and vomiting, chest pain or tightening in the chest, falling asleep or passing out but still breathing, fast heart rate, racing pulse, high temperature, sweating profusely, often with chills, irregular breathing or shortness of breath, convulsions, limb jerking or rigidity, stroke, feeling paralyzed while awake, severe headache, hypertension or elevated blood pressure, insomnia or decreased need for sleep, teeth grinding, and tremors. And the psychological symptoms include panic, extreme anxiety, hallucinations, extreme paranoia, increased aggressiveness, restlessness or irritability, extreme agitation, enhanced sensory awareness, hypervigilance, or being super aware of your environment, sounds, people, etc., and suspiciousness. So, what do you do when someone is overramping? First, you want to cool them down with ice, water mist, fans, a cold wet towel, anything to cool the body down. If their body is not cooling down, they may be experiencing hyperthermia, which is when the body cannot cool itself down. If this is the case, it is a medical emergency, and calling 911 is the best course of action. This can also lead to strokes, so if you're interested in the signs of stroke, we do have a video going over this. And it may also lead to seizures. So call 911 if the seizure lasts more than 5 minutes, the person has one seizure right after the other, the person does not regain consciousness, the person appears to be injured, the person's color or condition remains poor, the person does not start breathing with 1 minute after the seizure has stopped, start CPR, and if this is a first-time seizure.
So, now that we've discussed different types of overdoses, join us next time as we discuss general overdose information. And as always, you can leave a comment below if you have any topic ideas that you want to hear us talk about in future episodes.
Yeah, you can reach out to us on Facebook, YouTube, Instagram, Twitter, TikTok, and we also occasionally Twitch live stream. So follow us there to get notified when we do.
And don't forget to give this video a like, as well as follow or subscribe to our other social media accounts and turn on notifications on those so that you get notified of when our new content comes out. Otherwise, we will see everyone in the next video.